Let's talk about treatment. There are really 4 aspects of treatment that I think about. The first is making sure that someone's not getting exposed. I talked about how someone can test their environment. Treatment does involve, to start, if someone is able, and most people are, to start binders. When we identify the toxins that are present on the test, we use specific targeted binders for those toxins, and we work in one binder at a time, starting low and slow, building it up, not necessarily to the maximum, but have people identify where the dose works for them. Once someone is on appropriate binders, if they're having a significant benefit, and most people will benefit week to week and have improvement, but if they're having a really dramatic improvement, that would suggest they're probably not colonized, and we would simply retest it. Once someone's on the binders, then we would be looking to start antifungal treatment, again, unless they have a dramatic response. And the antifungal treatment could be starting with treating candida in the GI tract. Many people have candida overgrowth along with mold toxicity. Some people, more of their symptoms are in their sinuses, and we might start with antifungal nasal sprays. And then for either the GI tract or the sinuses, we may use biofilm disruptors, things to break down the protective coverings that the microbes can make. We will at times use systemic antifungals, which go into the bloodstream. The other piece that is important, thirdly, would be diet. So if someone's colonized with candida in the GI tract or mold in the GI tract or sinuses, they may be feeding those microbes if they're getting sugar or a relatively high carbohydrate diet, which is the norm in our Western culture. So there are dietary recommendations that really eliminate sugar, bring down carbs, and take out foods that have trace amounts of mold that could be triggering the immune system. Things like corn or potatoes or dried fruit, just to give some examples. The biggest piece, I would say, is really bringing down the carbs. Many people do well on a paleo type diet that's not heavy in fruit. There are individuals who are highly sensitive because of that mast cell activation or because of that autonomic or limbic system dysfunction, and it's very difficult for them to put anything in their body. And for those individuals, we would have them spend a good 8 weeks often doing limbic system retraining, doing vagal nerve interventions, really to get them to a place where their body will feel safe enough to sort of accept binders or accept mast cell interventions, mast cell stabilizers.